Good afternoon. My name is Noori, a fourth-year dermatology resident at Johns Hopkins. Thank you to the AARS for the invitation to present our data on a study that we did in collaboration with the ophthalmology department, hopefully to gain some more insight into the inflammation that occurs for these patients. So specifically, we were looking at the expression of cathelicidin and KLK5 on the eye surface for ocular rosacea patients. And this work was funded by a research grant from the AARS. So I have no disclosures. So to begin, as we all know, rosacea is an inflammatory skin disease that we commonly encounter in dermatology clinics. And out of the 4 clinical subtypes, we'll focus on the last one here, ocular. So ocular rosacea is fairly common. Some studies cite up to about 60 to 70% of patients with rosacea will present with some degree of eye involvement. And importantly, one-third of these patients will potentially develop sight-threatening corneal findings. Now, despite this prevalence, it remains underdiagnosed, likely because there's really no diagnostic test and really no validated criteria schema that can clearly define this particular subtype. And so the diagnosis remains purely based on symptoms that are reported by the patients, which sometimes can get overlooked if we're not asking or actively examining, and then various clinical parameters that are usually assessed by ophthalmologists. So the challenge further for diagnosing ocular rosacea is also compounded by the fact that the severity of skin symptoms doesn't necessarily correlate with eye symptoms. So you'll find, for instance, that maybe a patient who has very minimal skin involvement may not seek out medical care, and then their eye symptoms may progress without any treatment. So at this point, we don't really know or quite fully understand what causes the inflammation on the eye surface for ocular rosacea, thereby making the definition of what this particular subtype is and identifying the patients who have it a little more difficult. So prior studies have shown a role for components of the innate immune response that are involved in the pathogenesis of rosacea. So namely cathelicidin and then the serine protease, primarily kallikrein-5, that processes this propeptide into the active peptide fragments that are found to be all increased in lesional skin of rosacea patients. And the thought is that they probably drive this pro-inflammatory cascade, as well as maybe explain the vascular growth in these patients. And then more recently, cathelicidin and protease activity were shown to be correlated with clinical improvement during and after treatment with doxycycline, showing their utility as biomarkers for treatment monitoring and treatment response. So now these studies were all done in patients primarily with skin involvement, and the biomarkers were measured in skin tissue. If you look at some earlier papers in the ophthalmology literature, they do look at some inflammatory markers that are found in ocular rosacea patients. So we have metalloproteinase 8 and 9 that were increased in tear fluid of these patients, and then we have overexpression of ICAM1 and HLA-DR in the conjunctival epithelium. But at this point, no studies to date that have looked at whether the findings they see in the skin with cathelicidin and protease activity to be also on the surface of the eye for ocular rosacea. So our study, we had 2 main objectives. One was to look at the expression of cathelicidin and kallikrein-5 on the conjunctival epithelium of ocular rosacea. And then secondly, to determine if there's a link between the various ocular manifestations and then the level of target gene expression. So we recruited patients with ocular rosacea from the dermatology and ophthalmology clinics at Johns Hopkins. Clinical severity of the skin and eye were assessed by dermatologists and ophthalmologists respectively, after which conjunctival epithelium was collected by impression cytology by the ophthalmologist. And then for each of the samples, we did quantitative RT-PCR to measure the level of gene expression. And then for statistical analyses, we used multi-level modeling to compare the gene expression with the ocular manifestations, basically to account for the multiple samples per patient. So this is the list of the various criteria that we assessed for each of the rosacea patients. And then for each category, they were graded on a severity spectrum from nil, mild, moderate to severe, except one component of the eye exam, which was a yes or no assessment based on the presence of chalazion corneal findings and then Demodex on the eyelashes. We also did give each of the patients, or the rosacea patients rather, a global severity score for the skin and eye. So we ended up with 10 cases of ocular rosacea and then 6 controls. The baseline demographics are shown here. Out of the rosacea cases, we did have one patient who was using a topical dexamethasone eye drop. Otherwise, no patients were on any topical or oral antibiotics at the time of the evaluation. So first, we looked at the relationship between the severity of various components that were measured for skin rosacea and then eye involvement. And then we saw a correlation between non-transient erythema and then a global severity score for the ocular manifestations. So next, we focused on the eye exam alone, and then we determined if there were any significant associations between the degree of target gene expression and then increasing steps in severity of the various ocular manifestations for rosacea. And then for cathelicidin, you can see that with increasing severity of eyelid telangiectasias and anterior blepharitis, there was an increase in the cathelicidin expression. So similarly for KLK5, again we see that for increasing severity of eyelid telangiectasias and anterior blepharitis and now conjunctival hyperemia, you have increased target gene expression. And then interestingly, if you look at the prevalence studies for ocular rosacea and look across dermatology and ophthalmology clinics, the patients with ocular rosacea, the most common symptoms that they had were the very ones that we saw were significant for us in target gene expression. So when we compared the mean expression levels of both cathelicidin and KLK5, and then we looked at cases versus controls, we didn't detect any significant differences. Nor did we have any significant differences based on the presence of Demodex on the eyelashes. So our study had its limitations, one being that we had a very small sample size, and unfortunately we didn't have a comparator assessment of the target gene expression in the skin for each of the rosacea patients. So in conclusion, our data show an association between increasing severity of various clinical components of ocular rosacea and then conjunctival expression of cathelicidin and KLK5. And then secondly, maybe not surprisingly, that the process that drives the inflammation on the surface of the skin is probably very similar, the same on the surface of the eye. With that, I'd like to thank the AARS for the grant to complete this study, Drs. Kang and Chen for their mentorship, Alex, who helped with all the statistics, and then CTREP, which is our dermatology research program at Hopkins for patient recruitment. Thank you.
I have one question. I think it's very interesting that you've correlated the kallikrein and the cathelicidin levels along with the clinical findings. I don't think that that's ever been done before, so the fact that you were able to see that in a very small patient population is really interesting and definitely worthy of looking at. And one of the ideas I think moving forward, I'm sure that you've thought about as well, is that how would this change in response to treatment, say with doxycycline or something along those lines?
Exactly. I mean, because there's some preliminary evidence of the association, maybe the utility of using these target genes as like biomarkers may be helpful, especially for severity and treatment response.
Yeah.
Thank
Great.
you.
Thank you very much.